Welcome to the New Jersey Institute of Technology. I'm Steve Adubato. It is my pleasure to introduce someone who's been with us many times. An important conversation, Keri Logosso-Misurell, Director, Greater Newark Healthcare Coalition. Good to see you, Keri.
Same here, Steve. Thanks.
Trauma in urban areas, Newark, across the country, but particularly in urban areas. What kind of trauma are we talking about?
So we define trauma as an event or a series of events or a set of circumstances that a person perceives as harmful to them emotionally or physically or even life-threatening, and that has long-lasting negative impacts on their mental and physical health. And examples would be things like witnessing or experiencing physical, emotional, or sexual abuse, domestic violence, a parent who struggles with mental health disorder or a substance abuse disorder.
You have an initiative right here in the city of Newark to deal with trauma. Talk about it.
Yep. So Greater Newark Healthcare Coalition was fortunate enough to be selected as part of a multi-site demonstration project supported by the Robert Wood Johnson Foundation and led by the Center for Healthcare Strategies.
This is across the nation.
Yep, we're one of 6 sites in the country, so we're really excited about that. And it's the goal is to advance the adoption of trauma-informed approaches to healthcare.
Back up. Trauma-informed approaches. What does that mean?
So a trauma-informed approach is one that shifts the conversation from focusing on what's wrong with the patient or the person to what happened to the person.
Give me for instance.
So it takes into account the person's life circumstances. So in the healthcare setting, a person with asthma, you want to understand more about the person's home life and their family dynamics and what kinds of stressors they've experienced or are experiencing that would help you better tailor the care to treat the asthma in a more effective way.
What are we missing right now?
So one of the big things is something we now have an opportunity to do, and the show is helping with, is educate people about adverse childhood experiences or trauma and the lifelong impact that they have on health, with the hopeful and good news that there are interventions and preventive strategies that could improve health outcomes.
So play this out for a second. So we tape this series right here in the city of Newark, in the heart of the city of Newark, in the central ward where we are in NJIT, right around the corner, anywhere here in the city, in any city across this nation.
Right.
It doesn't have to be just in the city, but disproportionately crime is what it is in urban areas. So an 8-year-old kid, a 5-year-old, 10-year-old kid sees gang violence, sees murder on the streets, sees someone killed, sees it right inside their home. That has a lasting impact on that child. There are potential mental health issues that child faces for a lifetime. If those issues are not dealt with, we don't know for sure, but what potentially could we be talking about?
So the science is very clear that repeated exposure to adverse experiences, such as the one you just mentioned, actually changes the physical internal wiring in the brain and in the internal body of the individual. So it's particularly important during the youngest ages when the child is developing. So we know things now through a landmark study called the Adverse Childhood Experiences Study, done in the 1990s by Drs. Felitti and Anda, that there are, one, they're very common, the exposure to adverse childhood experiences, and there's something called a dose response. So the more adversity that you're exposed to, the more negative the impact on your health. And things like I'm mentioning, the actual wiring in the brain, things like your ability to learn or to have impulse control or addiction, the impulses that lead to behaviors such as addiction.
The ability to relate to other people.
Absolutely. So there's a real neurological basis, the impact that adversity has. And then even if you were not engaging in bad behaviors, such as the addictive behaviors or other things that could hurt your health, the science is clear that simply the exposure to adversity changes your immune system. It throws your hormones out of balance and affects your body in a way that you're more likely to have cancer, to have diabetes, to die 20 years younger than people who have not been exposed.
But Keri, what's fascinating here is there is reason to be hopeful if there's intervention. You're doing some work in some Newark public schools. Is it Dominic Lee?
It is.
Where is he?
He's at Brick Academy.
Yeah, we actually recognized him for some of his work. He was recognized by the Rustberry organization
Wonderful.
for making a difference. He was one of the terrific people we interviewed.
Yep.
Talk about him, his work, and what you're doing with him.
Sure. So as part of this multi-site demonstration effort that I mentioned, we are taking an approach that integrates healthcare and the educational system. So what we're doing in Newark is leveraging leadership such as Dominique Lee.
He's a teacher.
He is the CEO of Brick Academy. He is a teacher by training.
But he's the CEO of that organization.
Correct. He started as a teacher. He's a Teach for America fellow. Saw firsthand, trying to educate students, some of the barriers that are non-academic or traditionally viewed as non-academic barriers to success for the students. And he became frustrated, and he went on to develop the Brick Academy. And Brick Academy is a traditional public school, but with charter-like supports and resources, innovation, and other things that typical public schools would not have access to. So what Dominique is interested in doing is making his school, so specifically Brick Avon, a trauma-sensitive school, one that takes into account what the students are dealing with at home, how that's affecting their learning, what his staff is bringing to the school from their own personal lives, and how we can bring in the best practices to improve children's academic success. The other partner that's the leader on this work is Children's Hospital of New Jersey. They're interested in making their children's hospital a leader in a trauma-informed organization by training their pediatric, clinical, and non-clinical staff as the initial pilot group for being trained.
The Children's Hospital tied to
Newark Beth
over
Israel.
at Newark Beth?
Yep.
Part of the Barnabas
Correct.
system.
So there's great potential
RWJ
there.
Barnabas.
Yep.
So you're saying that if we intervene, if we understand these issues, and if this child gets help,
Correct.
there's reason to be hopeful.
Tremendously. And not only just the child, this is really a two-generation approach where we recognize the value and the importance of the child within the family. So there's a lot that we need to do to educate the caregivers, to understand their own exposure to trauma, what's happening with their child, and how to parent in the best possible way.
And again, the initiative that you're talking about is funded by the Robert Wood Johnson Foundation.
Correct.
And to disclose fully, the Caucus Educational Corporation has received a grant to do some of our healthcare programming from the Robert Wood Johnson Foundation.
Yep.
Keri, I want to thank you for joining us, and the Greater Newark Healthcare Coalition is doing important work. Thank you so much.
Thank you, Steve.
Stay with us. We'll be right back from NJIT right after this. Thank you so much.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this special edition of One-on-One with Steve Adubato at NJIT has been provided by NJIT, Investors Bank, the Healthcare Foundation of New Jersey, Century 21 Construction, Prudential Financial's Global Communications Department, the New Jersey Education Association, and by the Fidelco Group. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato at NJIT has been produced in cooperation with FiOS One News.